say the other thing is that, I think a lot of the times, and again, first few months, right? You're just trying to survive at some point, right? Like you're just trying to get through. So I think a lot of the times you and your C-section go on the back burner a little bit. And I think just even taking the time to 5-10 minutes, check in with yourself. What am I feeling? Because even taking the time to be like, it doesn't feel right. A lot of people aren't even taking the time to do that, right? So for me, I just want moms to check in with yourself. Feel your scar. What does it feel like? Is it hurt? Just literally tune in a little bit.
We're talking C-section recovery again, and this time with a couple of physiotherapists that might actually be able to help you post-operation. Hi, my name is Ashley Cooley. I'm the owner of Birth Baby Sleep and host of the Bringing Up Baby podcast. And today on the episode, we have Kristy McLeod and Kelsey Brown, both working at different CBI locations here in the Halifax area, both physiotherapists, and both with some extra training and information when it comes to after cesarean section. What are some ways that they can help if you're still experiencing numbness, even if it's been 5 or 10 years since your operation, or maybe there's some pain or discomfort there. But it's actually kind of surprising that there are physiotherapists. To me, it's surprising that there are physiotherapists out there that can help with your C-section scar. I love it. I want you to meet them and know that there's help out there for you as well. So here they are. Hi, ladies. Thanks for joining me today. I'm always excited to chat, of course. And I'm excited to chat about what we're going to be chatting about, which is more of that C-section recovery from your points of view. So thank you both for joining me today. Kristy, do you want to pop on first and say hello, a little bit about yourself and what you do?
Yeah, for sure. I'm Kristy McLeod. I work at CBI Health in Halifax. I've been a physio for about 10 years. My practice has been a mixed variety of things. It's kind of progressed over time, pretty orthopedic for the most part in a private clinic. But where I got interested in the C-section component of this was I just kept finding over and over in a lot of my patients that the C-section scar or weakness around the area kept popping up over time. It could have been, a few months later or a few years later or even many years later. So I started getting interested in that way and then started taking a few courses about it and since have had a daughter myself, although didn't have to have a C-section, was super helpful with friends and family and coworkers and my patients, of course. And so, have become relatively passionate about it. And I'm excited about where it's going to go in the future. So, happy
Amazing.
to be here today to talk about it.
Yay, awesome. Yeah. Kelsey, how about yourself? Tell us about yourself and what you do.
Yeah, thanks for having us on, Ashley. I'm Kelsey. I'm a physiotherapist and manager of clinical services at CBI Health in Bedford. I'm new to the province. I'm from Manitoba, so it's been a bit of a learning journey. But I've been a physio for about 8 years now. Similar to Kristy in ways, I treated a lot of active individuals back home. I managed a gym, so I found a lot of individuals, especially moms, would be able to go back into strength training relatively quickly. But then when we actually tried to look at sort of individual or isolate or look at sort of functionally, if they were able to recover entirely after their C-section, there was a lot of different things that would pop up. So that's kind of how I got interested in it, was learning more of the basics and foundation to assist with building back up and kind of working from there.
Yeah, because we know a C-section is a major abdominal surgery. There's layers of getting through to the baby. There's definitely going to be a big physical recovery that comes with that. And from the childbirth educator perspective hat on that I'll wear for a second, it's that 6-week period after having a baby where the uterus is shrinking back down to its pre-pregnant shape and size, and technically our insides, and that physical recovery should be, quote unquote, done or completed, or that's the end of your journey through pregnancy, basically. But I think we all know here that there's way more to it than just that kind of recovery over that 6-week period. And it can take sometimes longer than that. I'd really love to get both of your perspectives on what we should, those who've had a C-section, what should they consider or know about when it comes to their physical recovery after a C-section specifically?
Yeah, so great question. When I was learning more about C-sections, part of what surprised me was how common they were. Like 1 in 3 Canadian births get a C-section. So these are actually massively common. It's also the most common surgery in all of Canada, the UK, and the USA. So this is a very common procedure that's done. The biggest thing I would say when kind of considering for the incision is there's different types. So there's called the classic, which is what we used to do most commonly. They've reduced it because of the amount of adhesions and scars. So that is a good thing. Now we've transitioned to a lower transverse incision. So they actually cut through your lower rectus abdominis, which is one of your abdominal muscles. And then they push through the linea alba, which is the fascia that connects your abdominal muscles to pull out the baby. So essentially what they're doing is they're kind of creating like a mock hernia or like a diastasis recti and a separation of your abs. So I think that's important to understand sort of physiologically what's happening, because that also assists with your recovery. And that they have done studies that if you understand more, you reduce your anxiety and you have a better post-op rehabilitation, right? So I think educating on sort of the most commonly and the timeline piece, like you said, of that 6 to 8 week mark, sort of what's normal. There is another incision type they're looking at called the modified Joel-Cohen. They still are doing research on it, but there's some research that says there's better recovery. So some surgeons are starting to use that, but it's not common enough to kind of say enough about it yet.
Okay.
Other things, sorry, I just wanted to tie in that I was shocked to learn, but I thought it was really important, is at 8 weeks, if you have had a C-section, post-op, women who have had C-section, their abdominals are only 59%. They're 59% more fatigable than if somebody has had a vaginal delivery birth at 8 weeks post-op.
At 8 weeks post-op. Wow.
But at
Wow.
26 weeks post-op, there's no difference. So the recovery time is just significantly different if you have a C-section for your core and engaging those muscles. So I think that's a really key piece.
Yeah, absolutely. And I completely agree with you, Kelsey, that, it's the education and around like knowing what's common or a bit of what to expect can help reduce a lot of that anxiety and things. That's why we have the podcast. That's why we talk about it in prenatal class. And I love that we're getting to dive more into that, because these are things that are surprising to us all to learn, and just how common it is, right, Kristy?
Yeah, and I was actually just going to add, it's so interesting when we talk about, it's the most common surgery, period.
Yeah.
When we think about physiotherapy, when we think about rehab, just in general, anytime you go for a surgery, there's this whole elaborate, this is what rehab's going to look like. It might be 8 weeks, it might be 12 weeks. We're going to follow this protocol XYZ. The surgeons lay it all out. When it comes to C-sections, it's just really like, well, I hope you look after your baby and have a nice one. So, so we just don't write it down. We don't word for word, not week by week, nothing like that. So as a physio, when you look at that, it's like, where's my protocol that I should be following? Why isn't this all out there for everybody? And if as physios, we're like, where's the protocol? Then again, how is anybody supposed to know what they're supposed to do on their own?
Absolutely.
Exactly. Right? Oh my gosh.
So this is again where some of us and why this is all starting, and the research is coming now. And so certainly I always, if you don't know where to start, any physio, a lot of chiros are doing it, but any sort of rehab stuff, even just the basics, somewhere to start, just seek help from any of your health professionals,
Mm-hmm.
Yeah. Oh gosh. Yeah. So speaking on that topic, how can physiotherapy help when it comes to that C-section recovery, and when should somebody post C-section come to see a physio if they're thinking about it?
Yeah. So, the big things that we're going to look at are, number one, what the scar looks like and what it feels like. So we don't want to have any numbness. We don't want to have any pain, which a lot of people do, but we work through that stuff. And then, like Kelsey was talking about, learning what that activation feels like, what strengthening is going to feel like, and then how to work through that process together. So I know a lot of the times we talk about the shelf, right? Like if there's if it's the bump is there, or there's a shelf where that scar kind of gets stuck. So that's a lot of the stuff that we want to focus on, making sure that scar is mobile and can actually move around a bit.
Okay. So when you say
Yeah.
that you don't want to, I can imagine, no, we would like there to not be any pain after we have that in that recovery.
Yeah,
So
yeah,
that
yeah,
would
yeah.
clearly be a reason. I do talk with a lot of moms post-op at various stages that are
Hmm.
still experiencing that numbness. So when should
Hmm.
that kind of come back, or when are we expected to like feel that again? Or sometimes they're like, I guess this is just numb forever now. What's that like?
Right. And that's it. It's so different. And again, if you asked anybody in the health profession, you're going to get a different answer. Surgeons are going to give you a different answer. And again, Kelsey, maybe you could elaborate. I know you want to talk about the nerve kind of coming through, but depending on where it's cut, how it's cut, if there was any actual nerve damage or, anything major, your surgeon would tell you, your obstetrics gynecologist would tell you. But for the most part, if there's been no damage to the nerve, the numbness should go away. And if it doesn't go away, it's something we need to address. So it shouldn't be numb is basically the moral of the story.
Got it. Okay. So Kelsey,
Mm-hmm.
what are
Yeah.
your thoughts and information around that?
Yeah, no, I agree with Kristy. It shouldn't be numb. I think the other thing to touch on is it can get entrapped. So if you do have significant scar tissue, which is a piece of why physio and rehab in general can be so important, because you can get nerve entrapment or compression underneath the scar tissue sometimes, which can contribute. So I guess it kind of depends on what's driving that, what has happened to that nerve. And the other piece that can be so important is one of the nerves that often gets irritated or damaged or compressed actually drives or facilitates your abdominal muscles. So not only did they get stretched during the pregnancy, then potentially got injured if you had a C-section, and then on top of it, now you can't fully engage them because your nerve that supports them is injured, right? You're at a loss. So it is really important to figure out sort of what is driving that, because then the better they tend to do.
Yeah.
And I
Yeah.
think the whole point is that, again, like you say, actually, a lot of people do have numbness, and they have numbness for a long time.
Yeah.
And again, this is where I kind of started finding this in my practice. I'd have people 20 years later still numb,
Wow.
right?
Yeah.
And again, just didn't just assume that was normal and that's just what was happening because of the C-section. And then as you work through it and you kind of do some fascial work or mobility and strengthening and all those things, they're like, it's not numb anymore, you know? And so you can change it, which is really exciting.
Could you kind of walk us through? This could be different for everybody. We know everybody's experiences in post-op and with surgery and all that stuff, and what they're feeling or not feeling could vary greatly. But maybe just an example of someone you might be seeing post-op, post C-section. You mentioned, Kristy, already, like you're looking at the scar and figuring things out there. So would they come to you for numbness, for pain? Is there anything else, or what other kinds of things would you be doing at an appointment?
Yeah, so that would be one thing. Number one, checking the tissue around it, but then also looking at the strength and the activation of a lot of the muscles. So abdomen, obviously, but again, what's happening in the hips, what's happening in the back, especially because, again, we know with pregnancy, as things change, they start to come back. You land sometimes a lot of the times in a different place
Because your back or
before
something else
you
is
were pregnant.
compensating for the weaker muscles, and there we go.
That's it, right? And because when we're pregnant, we tend to be more in extension, which means our back is bent that way, right? That we're baby's carrying forward. Then when baby goes away, we have no muscles in the front, right? And then we sometimes stay in those patterns for many weeks, many months, many years. Our ribs flare out, right? Because again, we're making space. So again, just getting all of that stuff back to kind of where we're happy and back to where it wants to be. So I feel like anybody after birth should see physio. But again, with C-sections, even more so because there is that extra layer of surgical stuff that's going on.
Yeah. I mean, I completely agree with you. I know in France, there's physios for all the people having babies, and
so good.
Someday,
it's so good.
Maybe we'll catch up.
I know.
That's the dream.
Is it ever too late to see a physio? Like you already mentioned, Kristy, you've seen somebody like 20 years later mentioning that they're still numbness. Could you still work with that person and get that feeling back? Yeah.
Certainly. And what happens is over time, right, your body's always trying to do the right thing for itself.
Yeah.
So it's not that if you don't, you don't address it, that everything's going to be terrible going forward, but you tend to have weaknesses and patterns that you've developed over time that can, again, over time cause problems in the back and the hip and, that type of stuff. So it's always about seeing where you're at, when you come in, and then working towards whatever goals that you want to work towards. And for some people that's back to running, for some people that's just being able to pick up their baby again, right? So
yeah. And so it was a process to get there. It's going to be a process to get through it again, but all the more reason to see somebody who knows more about this and can help support you through it.
Yeah. And I know me and Kelsey had been talking about it, even if you're going to the gym and you're doing well and everything feels really good, but you haven't really, touched your scar too much, you're not really sure where you're at, even just coming in once to check in and just see, this is where I'm at. You may only need to come or see somebody once to just get a nice program, to check in, to see how things are feeling, and, go from there.
Cool.
Yeah, I've seen probably a lot of what Kristy's mentioning. I tend to notice in the acute phase. So if you're in that kind of 6 to 8 to 10 week and they're looking for some early sort of guidance on what to do, I find they're very flexed forward to kind of offload stretching through their scar. So they sort of end up in this really kyphotic position, trying to sort of protect it. So a lot of the education is, again, just start moving gently, start stretching through it, start touching it, get your partner to touch it, do some scar tissue mobility, because it helps also desensitize your nervous system. Like, you don't feel so fight or flight when you stretch it or when somebody touches it. It's okay, right? And starting to kind of help facilitate that rehab, like Kristy had mentioned, looking at their mobility above and below and making sure they have good mobility, because depending how their pregnancy was and depending how their birthing process was, that can impact so many things, like Kristy had mentioned. And just getting them to start doing some gentle exercise to get sort of the global core firing, like Kristy had mentioned. So I think that's sort of the acute phase. I love that we're talking about 20 years from now, because I totally agree. I think we can always help. I'm very biased, but I think that we're always able to do something to help get you towards your goals. So yeah, in the final stages, I think you can be more particular. Like, okay, you're doing really well in all these things. Is there any compensations that we haven't sort of looked at that we should? And how can we sort of help facilitate working towards your goals or reducing any symptoms that you have kind of longstanding?
It's so huge to realize that while this C-section and the baby was all concentrated in this one area, that the whole body is going to be impacted by that. And that could look differently to everybody. So when we're talking about that 6-week postpartum checkup with your doctor, and they're checking to make sure that your uterus has shrunken back down and maybe your bleeding has stopped, and, asking you those questions, it doesn't cover enough of what we should all be looking at. And so it's so wonderful to have so many physiotherapists and places where we can go to get that extra support.
Totally.
Kelsey, you already kind of briefly touched on this around like touching the scar. So I'm curious about what could people at home post-op, whether it is in the acute phase, so probably not till after 6 weeks. I take it that we're not really doing a whole lot. We're just really focused on that just recovery in general after baby and getting the lay of the land. Is that accurate, that we're typically waiting at least that 6-week period before we might be doing anything?
Absolutely. Yeah, you want to let that heal. You want to have a pretty healed scar before you even. And I would tend to say get clearance from your obs-gyn. Like, so when you have your follow-ups, right, making sure that you're clear. Like you say, the beginning is very much just focus on recovery, caring for your little, getting yourself as healed up as you can. And then probably like 6, even 8 weeks, depending on how your recovery is going, then start. And again, that incision is very healed. Then you can start moving it in different ways, up, down, side to side, diagonal, and start kind of from there once you get clearance.
Right. And so that must be the kinds of things that you would go over with somebody in an appointment, is how to move it around and things like that. So it's just kind of getting back in touch with your core again, and getting back in touch with, now this body is now, well, sort of back to being yours. And getting back in touch with all of that. So doing some movements after being cleared, after roughly that 6-week checkup. can be helpful for starting that process. But again, you'd probably want to see one of you or someone like yourselves to help you with exactly what that looks like, right?
Yeah, for sure.
I would say the other thing is that I think a lot of the times, and again, first few months, right? You're just trying to survive at some point, right? Like you're just trying to get through. So I think a lot of the times you and your C-section go on the back burner a little bit. And I think just even taking the time to like 5-10 minutes, check in with yourself. What am I feeling? Because even like taking the time to be like, it doesn't feel right. A lot of people aren't even taking the time to do that, right? So for me, I just want moms to check in with yourself, feel your scar. What does it feel like? Is it hurt? Just literally tune in a little bit, because a lot of the times it's a really traumatic event that's gone on, right? Either maybe it was scheduled, but maybe it was an emergency, or maybe it happened really quickly and you weren't expecting it. So a lot of the times there's a lot of mental health stuff also around the scar. Some people don't want to look at it. Some people don't want to touch it. And again, that's another piece that you kind of have to work through. But even just checking in with yourself and going like, okay, I'm aware of it. I know it's there. I think it's good. I think it's bad. It's not too bad right now. But just so that you actually know where you are to begin the process, right? Because sometimes we don't even stop to even think about what's actually going on with our bodies.
Yeah,
right?
Yeah, totally. Yeah. That's absolutely where it's at for me. What in terms of like how I think about this too. I personally did not have any C-sections with my 3 children, but the things that I hear, the things that I just know, having the conversations that we did on last week's episode of the podcast with 2 moms that have gone through C-sections, it's clearly a huge mental adjustment, a mental and a physical adjustment. So keeping both of those things in mind. And again, I think for me, it would help to know that there are services and people that do know more about this and how they can help you. And that it doesn't have to be this way forever if they are in pain or if they're not having any feeling. So that's always good.
Yeah, exactly that. Like someone is there to help you. Something can change, right?
Yeah.
That's so huge. But in terms of, what you can do on your own, even I usually just say to people, just starting with breathing exercises, I think is the key. A lot of people, it's an easy one and you don't have to necessarily be worried about, is it healed? You don't have to worry as much about the specifics about the scar, but even just working at taking those nice big belly breaths and stretching out through that lower abdomen. And most people can kind of tell the difference between breathing through their chest and breathing through their belly. And if they tune in enough, can kind of work through some of that tension that they feel in that area.
Beautiful. A great place to start. Absolutely. Is there anything else that we didn't touch on that either of you feel would be important to share, people to know about when it comes to their C-section recovery?
I would just add to that, like, I love what Kristy was saying about breathing, and I 100% agree with that. I also would just say move a little bit, like kind of tying into that 5 to 10 minutes, check in with yourself, move a little bit, because you're actually more prone to blood clotting after a C-section for the first 3 months. So a little bit of movement throughout your day to like move that blood, get sort of that general muscle pump effect would be so helpful too. And again, that ties into the education piece. Like, we're making sure people know this stuff. So if you can take that 5 to 10 minutes, check in with yourself, stretch, deep breathe, take a little bit of movement, I just think it can go such a long way in your well-being after.
Absolutely. I think this is all a great reminder, whether we've had a C-section or not, but definitely if we've had a C-section, but have after baby, we got to think more. Of course, we have to take care of the baby, but we have to think a little bit more about ourselves and what we've gone through, and that recovery is just as, if not more important than anything else, because of your needing to be well to now take care of this little human. So we do tend to really forget once that baby is out or babies are out, it's all about the baby. And we want everybody coming over to meet the baby and to be all about the baby. But I'm a strong advocate, and I say this in prenatal classes all the time, that the people that are coming to see you immediately after having a baby or when you're at home in those first few weeks or so, those should be helpers, and so that you can parent and feed your baby, so that you can do recovery And they should be there to help you a lot of that time too. Bring you food, hold the baby so you can maybe go do a little bit of movement on your own or have a shower and just have that help. Let somebody else get the laundry so you don't have to worry about your abs and your strength to be picking up and doing all the things. Like, that's who we want to have in our corners, right? In those first couple weeks.
Absolutely.
Yeah, I would just say, again, what I want people to, number one, want people to know that there's lots of support out there for them. But number two, to actually just take the time to do it. Because again, whether you've just had a baby or specifically you've had a C-section, taking the time to go to the appointment, that's the hard part, right? It's the I just don't have time. You have the time, bring the baby with you. They can hang out, take care of yourself. Take care of yourself.
Absolutely.
So important, because if you're not feeling 100%, you can't give, right? And so I think that is just so important for moms to hear. And so I even have friends right now that I'm like, have you done it? Have you checked in? And they're like, yeah, I got it. I'm going to get around to it. You're like, okay, do it. Everybody, look after yourself. Get the help that you need.
Use the Nike slogan, just
Just do it. Yeah, you got to put it in your calendar. You have to make that appointment. You have to, it can be very hard, as we know, to get out with a little one, and by the time we're ready to go, and then they poop up the back, and we know all of this stuff happens, and it can keep us home, and it can keep us away from taking care of ourselves. But it's definitely probably the number one thing new moms need to hear, is that that's very important to do. Thank you both so much for this wonderful conversation. It's so great to know that there are people like yourselves. So you're both in the Halifax area. That's where a lot of our listeners are from, but not everyone. So it's finding your local physiotherapists that may have some maybe extra training in the C-section stuff. But would you say, like, generally a physiotherapist would be able to assess or help with somebody in that state?
All physios can assess. I do think additional training is helpful.
Sure.
But I also think every physio should be able to kind of give some guidance, and if not, hopefully connect with somebody if they don't quite know. But I think everybody can provide some insight and some help. Kristy, what do you think? Yeah.
Absolutely. Yeah, I agree. Every physio is going to, again, we know about movement, we know about exercise, we know they're going to be able to give you all those basics, the core strengthening, all of those positioning things we were talking about. But yeah, in terms of, specifics about scar tissue and the healing process and all of those tiny little things, somebody who does have experience in it is going to, just like anything, going to be,
that much more helpful.
A bit more versed in it. But again, if you're rural and you don't necessarily have access to that, physios are it's a huge community. Everybody knows somebody. If you don't know, reach out. Somebody knows somebody to reach out to a physio that can help get you the information that you need.
Beautiful. And you're both with CBI. Kristy, you're in Halifax. Kelsey, you're in Bedford. Thank you both so much for this conversation. I hope you start to see more people coming through your doors, more moms that have had C-sections, because we know it's important that they don't have to have the numbness forever. They don't have to have the pain forever. And that can be something that they can work through. So very promising stuff. I love it.
Thanks for having us.
If you're looking for more information or support along your parenting journey, check out birthbabysleep.ca. That's where you're going to find prenatal classes, postpartum and new baby resources, and sleep support during the childhood years. You can now join our Bringing Up Baby community membership as well, which has tons of additional benefits to helping you through all kinds of sleep challenges and transitions, navigating the transition to solid foods, and even your transition through early parenthood. If you have any questions, just send them my way. Lastly, but certainly not least, if you got something out of this episode or our show in general, leaving a rating or a quick review goes a really long way to helping others find us. So please consider leaving one. That's all for now. I'm Ashley Cooley, and we'll see you back here next time.